So we're here today at the 5th Annual Glaucoma Patient Summit in Long Beach, California. Joining me today is Amy Dixon, an accomplished athlete and outstanding patient advocate. Amy, thank you for being our patient keynote speaker at today's Patient Summit.
Thank you for having me.
I've heard nothing but great things about your talk there.
You're too kind. It was a lot of fun, and what a great room of people, and very engaging and great questions, and I'm inspired by all of them.
On that note, we want to know what has inspired your passion for patient care and advocacy.
I run a support group, and one of the frustrations that I get is that so many people turn to Dr. Google when they're facing important questions regarding their eye health. And I thought, my goodness, I don't think I would trust my eye health to a bunch of strangers on the internet. And so that's when I realized what an important resource Glaucoma Research Foundation is for having a trustworthy source as a place to go to educate yourself about your disease. And I got really frustrated that people just didn't know about these resources, and again, either stumbled upon these sites that are either sponsored by a pharma company, which are helpful, but again, it's not an objective view of how to treat and to advocate for yourself for glaucoma. Like I was when I first got diagnosed, I was uninsured, and there's millions of uninsured and underinsured patients in the United States, and so trying to figure out how to help them to the best of their ability and teach them how to get the resources and how to get access to these medications and doctors. And it's scary when you get a diagnosis as lifelong and debilitating as glaucoma can be, potentially. One of my biggest frustrations was watching people lose their sight to a very treatable illness. And so if I can be their voice or teach them to have their own voice and facilitate that happening, then I feel like I've done my job as a human being in this world, because not everybody is outspoken and as inquisitive as I am. A lot of people get this disease and then curl up into the fetal position and are overwhelmed by all the information coming at them from the internet and from other patients in these support groups. So I wanted to give them the ability to feel empowered and know that if they can't have a voice, that I'm going to be a voice for them and I'm going to help them through this journey.
In your opinion, what are the key elements of providing exceptional patient care?
Communication, I think, is really the most important. Communication and education and community. Surrounding yourself with good information that is from a reliable source. Again, GRF does a great job with their website. Community, hopping into online support groups, and communication with your care team, making sure that they really understand you not only as a person that has glaucoma, but as a person, as a mom, as a student, as a person in the workforce, someone who would like to continue driving for many years. What are your goals and aspirations? Someone whose sole goal is to be able to walk their kids to school every day. That level of maintaining vision may be very different than somebody who is a surgeon that needs very precise vision every day. So understanding what they're using their vision for and how best to manage their care.
Can you discuss any ongoing projects or initiatives you are currently involved in that aim to improve patient care?
Well, thank you for asking. Some of the initiatives that I'm involved in currently are meeting with some of the larger eye hospitals around the country, and as of 2022, it has been approved that most insurance companies will cover patient advocates in any major eye health practice. And during the pandemic, a lot of those positions were let go because it was not a profit center for the hospitals, because it wasn't covered by insurance. And now that it's not only billable, it's reimbursable, it actually behooves the hospital to have a vested interest in having a patient advocate on staff. So my passion is to put somebody in every major eye hospital that the second you get diagnosed, you sit down after you've met with the physician with that patient advocate and sit and discuss everything you need to know about glaucoma, how to administer drops, you'll get a demonstration, pamphlets on low vision if you're already there, some apps to use on your phone that might help you today as far as magnifying things in the grocery store, and maybe some advice on even over-the-counter glasses that you can buy, at least to help with your night vision while driving. Services for transportation to get to and from your appointment if you're no longer driving, helping you maybe with childcare because you can't afford to get your appointments because you are a single mom and you have 2 kids at home, or you're working and you can't get the time off of work. Like, how do we keep these people coming back and managing their disease while still being part of the workforce? And so That really is my passion project right now. I'm working with Mount Sinai, Manhattan Eye and Ear, and Shiley Eye Institute, respectively, and hopefully soon Wills as well. And working on with a company called Alchemy Vision, which trains ophthalmology techs. And so we're trying to get these patient advocates certified as board certified patient advocates in the focus of ophthalmology and get them placed everywhere around the country.
That would be amazing. Yeah, I can see how a patient would benefit after being diagnosed. It's such a scary and daunting journey. So to have someone who's well versed on all the resources to help you.
And the accountability, having somebody that's going to be there through your journey. You may only see the doctor for 5 minutes at a time, but this is going to be your person who's going to handhold you through all the other stuff that's involved with glaucoma, not just the treatment, your whole life.
I look forward to learning more about that in the future. What advice do you have for patients that are faced with vision loss?
My advice for patients facing vision loss is meet with those who are already visually impaired and get to learn what their life looks like, because it's not as scary as your imagination. Before I lost my sight to uveitis and later glaucoma, my only experience with people with low or no vision were the panhandlers on the subways in New York City. So my vision of someone who was blind was that I was going to be homeless, or I was going to be completely dependent upon a group home to take care of me, that I couldn't be a part of the workforce. That was literally my only frame of reference. I had no idea that people could become athletes, attorneys, work in IT, and do all these amazing things despite vision loss. And so meet with these people that are low vision or no vision and learn how they function, so that it takes the stigma and the scariness out of it. And then start learning how to do everything that you're doing now just a little bit differently. Maybe you need to slow down initially and do it a different way, but then you'll be really good in that alternative method, whether that's cooking, whether that's gardening, whether that's adjusting your driving schedule. So, okay, you're not going to drive at night, and you're going to minimize driving in residential areas, or you're going to start using public transportation and maybe do that 1 day a week, so you start to get used to it when the time comes that you have to use public transportation full time. So giving yourself some grace and preparing before the big things come, because glaucoma is scary and things can happen very quickly sometimes. Hopefully your progression of your disease is slow, but if things do progress quickly or suddenly, at least you've prepared yourself.
Do you have any recommendations for someone as to where to start looking for other people who may be experiencing low vision, or what would be a good starting point?
A great starting point for people with low vision is Glaucoma Research Foundation, obviously, getting onto the website, some of their partners like the Braille Institute. There's several low vision organizations around the country, like Lighthouse for the Blind. If and when that time comes, every state has a Board of Education and Services for the Blind. I was part of BESB, which is Board of Education and Services for the Blind in Connecticut, and they did my orientation and mobility training, and then helped me with my guide dog application when I decided to switch from a cane to being a guide dog user. So use those resources online. Again, Lighthouse, GRF, Braille Institute, low vision centers. If you Google low vision centers and ask your ophthalmologist. I mean, they should be your team member, and they should have this information available to you.
Thanks to research and innovation, there are more treatment options for glaucoma patients. But what would you like to see that would improve a patient's quality of life?
Great question. Technology has come so far, and one of the things that I'd love to see push the needle forward for patients is more accountability and more of that patient compliance. Understanding that you can't be a passive participant in your care. This is a lifelong illness, and there's going to be battles. There's going to be times where things are quiet, but educating yourself on technology, and again, using tools that give some accountability, whether that's a family member, whether that's an app, or even is something as simple as setting a timer on your smartphone to take your drops every day. Just holding that a little bit of accountability, because I don't think there's any worse feeling then when I got diagnosed with uveitis, and I waited 3 months to go to the doctor, and I lost 70% of my vision because I waited. And so I don't think there's any worse feeling than knowing that you could have done something and didn't. And if I had gone, I'd still be driving. So, it really upsets me and enrages me when I hear someone is just willing to let that happen to them. You have to be active in your care. Like, you don't get your vision back once it's gone. And so I think it's not like you can just have a surgery that's going to fix everything. It doesn't bring the optic nerve back once the optic nerve is dead. That's it. So I think it's really important to use the technology to the best of your ability to see as long as you can.
What would a cure for glaucoma mean to you?
It'd be amazing. I say these lifelong eye diseases, to find a cure for them, such as glaucoma, would mean freedom for millions and millions of people. I mean, there's over 6 million people in the United States that have glaucoma, and that's just a small portion of the entire world. And the financial freedom and the freedom to be contributing in the workforce, 78% of the visually impaired population is unemployed. That is staggering, and that's unacceptable. And glaucoma is obviously at 6 million patients, the number 2 leading cause of blindness, is a huge contributor to that unemployment factor. So to be able to see people continue to be financially contributing to society and be fulfilled by careers and be fulfilled by their families and be able to have that breath of fresh air and knowing that the bottom's not going to drop out. Not that your life is horrible with glaucoma, it doesn't have to be. I mean, I'm living proof that you can live a very full life with glaucoma and a very happy one. But I'd be lying if I didn't say, it's been a lot of scary nights and scary surgeries. I've had 39 surgeries to save my vision, and post-op complications, complications from drops, side effects, and things like that. If I could get back all that time and all those hours traveling back and forth to the doctor, I mean, that time, who knows what I could have accomplished.
And we hear that you have a new service dog.
Not yet.
Not yet. On the way. Can you tell us a little bit about the process, maybe how long it takes and how it's benefited you? Yeah.
So I was a cane user initially after my diagnosis and when my vision took a sudden turn where I was below the legal parameters of blindness to drive. And so I had gotten hit by a Prius while crossing the street because I didn't hear it. This is like 13 years ago. And so after that, my family intervened and said, you really need to get a dog, something that has an opinion about cars. And so my first dog was from Guiding Eyes for the Blind on the East Coast, and he was a wonderful yellow lab named Elvis. And then when he retired at 8 years old, and I got my German Shepherd from Fidelco Guide Dog Foundation in Connecticut, his name was Woodstock, and he just passed in January. And so I got on the waiting list for Guide Dogs for the Blind, who's here this weekend. And the pandemic really put a damper on training guide dogs because a lot of the schools weren't able to socialize the dogs in a normal way because they weren't able to get into movie theaters and shopping malls because a lot of those places were closed. So they had a very high failure rate of dogs during that time. So there's a big backlog in some of these schools. Some are looking at 18 months to 2 years. So I got my name on the waiting list, and they said that it was going to be 8 to 10 months. That was back in March when my application was approved. And I literally got a phone call 3 weeks ago saying, we actually found the right match for you. It's like Match.com or an arranged marriage for people and dogs. It's wonderful. And so I'm meeting my new boy or girl in 3 weeks on July 16th up in Oregon on their main campus. And I'm really excited to meet this dog. They don't tell you anything about it. They don't tell you the breed, the gender, nothing. So I know that they've been doing this for 60 years, and they're really, really experts at matching the personality and the style of the dog and the speed of the dog with the person. So I'm pretty excited for my partner to come. As a glaucoma patient, my hope for the future is obviously that we cure glaucoma, but even more than that, I think the most important thing I hope is that patients realize that it is not an excuse not to live your life. It is a reason to rise to the challenge and really find yourself and really find that strength that you didn't know you had and fight. I think people don't realize how strong they are until they're put into really difficult situations, and I think the universe sometimes tests you, and I think glaucoma is a worthy adversary, and I think I would love to see people rise to the occasion and manage their disease, and even if they're losing battles, that they're winning the war because they're living their lives with glaucoma and being active.